Welcome to the Remarkable Dentist Podcast with me, Fred Joyal, where I interview amazing dental practice owners digging into their successes and failures, their insights and hindsights, getting their views on where dentistry is going, and discovering what it took for them to become remarkable. Welcome to the next episode of the Remarkable Dentist Podcast. In this episode, I'm interviewing Dr. Fariborz Rodef, who has the Kids Children's Dental Center, which is a group of practices. And it's quite an interesting story. And I think you're going to be really interested to hear how he got this far and how expansive it is and the philosophy behind his pediatric and orthodontic practices. So, Dr. Rodef, welcome to the podcast.
Thank you. Good morning, Fred. Thank you for inviting me to this podcast. I'm very excited about coming in and telling a little bit of the story of my life and my dental experience and my success and my failure in dentistry to our audience.
Yeah, we've known each other quite a while, and I've been watching your progress. And so, how did you get started in dentistry? Let's go all the way back. What drew you to dentistry?
Amazing question. And the interesting part is sometimes I talk to my parents, the patients' parents, and tell them how I became a dentist and what motivated me to become a dentist and a pediatric dentist. My experience comes from my childhood. When I was about 8 or 9 years old, I had a really bad toothache, could not sleep at night. In the morning, my dad take me to school and say, okay, I'll take you to a dentist this afternoon. Around 10 o'clock, 11 o'clock, I had so much pain that the teacher had to dismiss me from the class. And my dad came in and took me to a dentist. My pain was so excruciating that I really, once he numbed my teeth and my pain gone away, I was like relieved from the pain. I said, this is a great job. And my dad noticed that I kind of enjoyed the part of the dentistry, and I kept my mouth open as an 8-year-old, let the dentist do all the work. I think I had like 6 extraction, 4 or 5 fillings, and a lot of work done in one visit. And I was so happy getting it done. I said, this is what I really need to do for, people. Is such a nice person to relieve me of pain. And that's the reason I really decided to become a dentist. So I moved from Iran 1979 during Revolution, moved to San Diego, California. I stayed there, did my high school, ended up finishing my high school, and then went to college to San Diego State, and then transferred to USC Dental School in 1985. And I really enjoyed the dentistry itself, but once I got into the clinic and working on a patient, I noticed that I really can't deal with adults. I really couldn't tolerate adults. So I said, let me try something. I did mobile clinic, and I went in the dental clinic of Pedo, and I started seeing the kids, and I started loving what I did. I enjoyed my communication with the kids. I felt that they kind of trusted me, and I trusted them. They let me do the work. Of course, I was working on a little bit older kids, 7 or 8-year-olds. Conversation was really good. So that's how I ended up becoming a pediatric dentist. I decided to go to a specialty and finish my specialty at USC. And I ended up staying in LA, where I met my wife in dental school. Last year of dental school, we got married, and I stayed in Los Angeles. So once I became a pediatric dentist, I really had no intention of opening my own practices. I wanted to learn a little bit about business. As you know, dental schools, they don't teach you anything about business aspect of the dentistry. They teach you how good you can become a dentist, but when it comes to business, you really don't have any knowledge of what you need to do, how you need to build insurances, how to take care of patients, how to take care of employees. So I started working from 1991 through 2001, 2002. That's when I decided, you know what, I should open my own practices. At the time, I was working into 3 or 4 different general dentists taking care of their kids' patients. And I kind of enjoyed doing the dentistry itself, but I wanted to have my own office. So I started my first office in West Covina, California. I had a partner at the time. We decided to take parts. I worked 3 days, she works 3 days, and we started. And our vision was to open more practices and expand our group to become a little bit bigger practice. So, and we did extremely well in the first year of once we opened, because we really didn't have any pediatric competition in the area. It was only us, and there was another pediatric dentist a few blocks from us, but we weren't really competitive with each other. We were getting patients from each other. There were certain patients that he couldn't handle, would send us, and there were some certain patients we couldn't finish up, we would send to him to put him to sleep. So that's how we started practice. A couple of years later, we opened second practice in East LA. And at that time, my partner suddenly realized that she really doesn't want to have multiple practices. And she really wanted to stay with one practice. So we decided to separate. She has stayed in East LA. I continued keeping the West Covina location. And that's how my business has started. Few years down the line, in 2007, I opened my third, or actually would be my second practice, with one of my associates that she lived in Glendale, and she was interested opening a practice around that area. So we opened the office in Eagle Rock, and we started expanding that time. And my relationship was such a great with my partner that there was more associates coming into West Covina, and they were interested opening practices. And that's how I end up continue opening practices. We open one practice every couple of years. So in 2010, we opened one, and 2012, another one. Right now, we have somewhere about 13 to 14 different locations in Southern California.
You should know how many. You're opening so many you can't keep track. Okay.
Yeah, 13, 14. The reason I say 13, 14, because we're going to open one practice in next 2 weeks. It's going to be
okay. Yeah. So by the time this podcast comes out, it'll be 14. Okay.
Yeah. So next month down the line, you talk to me, we're going to be 17 practices.
No, so you are, and so all of these are self-funded, right? Or are you? So people are going to be very interested. It's like, how do you get up to 14 practices? They can see how you would have the second one and maybe the third one, but you're rolling, opening a practice a year at this point.
We're opening 3 practices per year right now. So that's our goal, is to open 3 practices every year and expand to 2015. 2025, we're looking about between 22 to 25 practices in Southern California. So we are getting loans for our practices, but we're sufficient enough that if I don't get the loan, we still have income from the practices, or profit from the practices really pays for the new practices to be open. So that's not the issue. At the beginning, it was, when I opened my first practice, we were trying to borrow $400,000 to build a practice. This is 2002. Right now, in 2021, we're looking about $800,000 to $900,000 to open a practice, to start a practice. And we do like a de novo practice. We really don't not looking to buying a existing pediatric practice because we want the setup to be all offices to be the same as far as the construction.
So the you've got a specific architectural layout that you like, so you build it from scratch, basically.
Exactly.
Yeah, because I can imagine, we all know that a good pediatric office is designed very differently than a GP office. And I think you've probably, so when did you feel like you had cracked the code, like, oh, this is the layout that works? Was it by the second or third practice, or did it take longer?
Never. We're still in
So by practice 22, maybe you might have it.
Maybe by then, yes. Every time you open one and you realize some defaults or some faults into the practice, and finding exactly the space that you want is very difficult too. So we have reached certain amount of certainty on what we like to find to see. We're between 3,400 to 3,700 square foot of a space for us is perfect. We get somewhere about 15 to 16 chairs in those locations. So we want to have our own open bay ortho and open bay pedo separate, and then have 4 to 5 treatment rooms in the office to be able to handle the treatment of the patients.
So have you managed to find dentists who are okay working with adults? Because you're doing orthodontics at this point. So obviously you don't want to be treating, you decided early on you don't like dealing with adults. But you're obviously, you've got, how many dentists do you have working? It's a huge number.
So we have about 40 dentists working in our practice right now. And that numbers is going up every year. As we're growing, of course. Out of these 4 dentists, I have about 9 dentists that they're my partners. The others are some of them are interested to become a partner, some of them are not. Some of them, they like to come and work and not worry about the business aspect, and they really don't want to be a partner in the practice. But most of the dentists that we work in our offices, our associate, they're very interested to become a partner because the way we're set up, the system is beneficial to both partners and myself. In terms that I allow the dentist to do what they feel the best for the patients. One of our logo or mission is really to take care of the patients. I think taking care of your patients and be able to help them, it brings joy and satisfaction to our doctors and our staff. And that's one of our goals, and that's one of our successes been that we really want to treat every patient like our own child. And that's how we go about, and that's how the dentist, when we're picking a dentist, we want to make sure that they match our mission and they have the same goal into the practice.
So you basically grow partners. You bring them in as associates, and then sometimes they want to become partners, and so you have this partnership agreement that you have a working agreement that you know how to set up and bring them in as a partial owner in each of the facilities. Are you centralizing any of the activities like call centers and things like that?
So yes, we are. And mainly is when you're having 2 or 3 practices, you really don't need to be centralized. You can have each office individually take care of itself, and you really don't need a corporate to run the offices. But after 4 or 5 offices, you really need to look into having a corporate, because at that point, you're going to need a HR manager. You need a credentialing department. You need a billing department that can handle all this in a separate location. So we are definitely been centralized for the last 5 years. We have our own corporate for 5 years. Now we just got into, we used to have the billing departments done by another company. We're bringing it into our location. We are going to have our call center hopefully set up in the next few months. We will have a call center and billing department inside the office and inside the corporate.
Yeah, so you've reached a point where the consolidation makes sense and the centralizing of the services makes sense. And of course, there's economies to that as well as efficiencies, right? You know, it's easier to be profitable when when all of that stuff is handled sort of in a specialized way, rather than the multitasking that happens so much in an individual dental practice.
Absolutely. I mean, we basically, as a DSO, we were able to negotiate with a lot of merchants and companies, even for the leasing. When you come in as a DSO or as a big group, I can negotiate the lease much better than a small office. When I started, I was not able to negotiate because I didn't have any assets. Now, with the DSO being such big company, they feel the landlords feel more comfortable to give a better rate on the rent and the lease for us. You know.
Yeah, they see that they know that dental practice is longevity, right? You're not coming in for 5 years and leaving. You're coming in for 20, and you've got the leverage. I hadn't heard this before, that actually being a DSO will give you better leverage in negotiating the lease, but it makes sense because you got a much bigger asset base, and they also believe you can go anywhere, but the risk is lower. You know, what they want is somebody who pays the lease in and out, you know, and doesn't move and doesn't go out of business. So, you know, dentists are a good risk anyway, but you know, not always.
No, absolutely. Yeah, I've been in West Covina since 2002. So we're looking about, this year is 19 years we've been in this location. And we've expanded from 3,500 square foot space in this shopping center. Right now, we're about 13,000 square foot. So we had expanded our ortho and we had expanded our corporate and call center in this same shopping center. So the landlord is like, once he had an empty space, he always called me, do you need more space? You know,
so when did the orthodontics start?
So actually, my orthodontics started from the beginning. My partner's husband was orthodontist, so we had him in the practice with us 1 day a month. And once my partner and I got separated, I had to bring another orthodontist in the practice. And from the beginning, I knew it's a great relationship between ortho and pedo. The orthodontist really needs the pedodontist. And at the same time, we have enough patients to feed our orthodontist as well. When you talk about adult dentistry, we really don't bring any adult ortho patients into our practice. All our ortho patients are children's. We do have some adults, and usually those are the parents of the kids. If they bring the kids and they like the orthodontist, they say, can I get braces? Sure, we can start braces on you as well. But most of our patients, 90% of our ortho patients are children's as well.
So you're not doing a lot of clear aligners. Are you doing any?
No, we do have some clear alliance, and also we have other brand as well.
Yeah. So,
you know.
So there's another thing you do. You do vision. You have optometry centers within the practice as well.
So yeah, it's an interesting point. A few years ago, I met a gentleman from Northern California that he had a vision and kids visions in his dental practices. And he introduced us to the vision department, and we started bringing the vision into West Covina. Unfortunately, we started in late 2019, and last year, as you know, we hit the COVID, so it was really difficult year for us. But I think we're going to be growing hopefully next few months. Once the COVID issue goes away, we're going to expand our vision into multiple practices as well.
So, all right. So this brings up another question. So how were you impacted with COVID? How were all of these practices? How did you ride this out?
So it was a little challenging. And I tell you, it's an interesting point is also being a multiple practice and having different location, it helped us a lot in be able to ride these difficult times. We were open almost 5 days, 6 days a week during the COVID. Even when the offices were closed, we kept each office open 1 or 2 days for emergency, and we were able to move our patient from one location to another if the emergency needed to be done on the same day. So it was a great capability to be able to see patient immediately, not schedule them for a week later to be seen in terms of emergencies. And we started seeing patients back on May 15th when the LA opened, allowing the dentist to see patients. We've done well. Of course, like any other practice, we had to bring air purifier into practice, and our open bay, we place the curtains to separate each chairs from each other. And we reduce the number of patients that we see, but overall, we're coming back to get to 100%, hopefully by next 2 or 3 months.
Yeah, so it's probably changed. The waiting room is usually a pretty active place in a pediatric practice. Imagine that changed quite a bit.
Yes. We had about West Covina location, we have about 25 to 30 chairs, which during the morning or afternoons, all the chairs were packed and people would be standing up waiting to go inside. Now we only have about 6 to 8 chairs, and these 8 chairs are most of the times are empty. We're able to actually coordinate as soon as the patient walks in, be able to take him to the chairs and not have him wait in the reception area.
All right, so let's look at you've had an interesting growth trajectory and fairly significant since 1990. What do you think your biggest mistake was, or one or two of your biggest mistakes along the way?
Well, one of the biggest mistakes, I should have started this way before 2002. I really should have. By 1995, I was confident to open my own practices and start growing. So I'm probably about 7 years behind. But in a term, I think overall, there has been certain mistakes done down the line, but thank God none of the mistakes are big enough that really has affected me. So the thing is, for me, is to learn from your mistake and not repeat it. When you talk about, opening multiple practices and having, be able to have a beautiful floor plan, we have set up a really nice floor plan in our practices, and we've remodeled. We grow and we change every time we learn something new, we change it to the new part. But the fact is, as a person, I like the challenge and I like the change. And I don't mind doing mistake as long as it's not a big mistake. And learning from the mistake and making sure not repeating the same mistake over again. To me, that's the most important part.
And you were very hesitant and underconfident, it seems, in the 90s to really leap, and then all of a sudden you've kind of gone the other way. You're a different Dr. Rodef than you were in 95.
Absolutely. And for a few years working for other people, I felt comfortable and relaxed, not to challenge myself. Now, as I'm growing, actually, I like to challenge myself, and I wanted certain goals and change the goals to a better goals and be able to change myself to be a better person as well. So that's my goal is for the next 3 to 5 years.
So everybody's going to be interested, because they look to me for marketing insights. How do you attract patients? What is your primary way of getting new patients?
Well, one way is reading your book and learning about marketing. It's amazing, has opened our eyes to a lot of ways to market. And, in 2002, my biggest marketing was Yellow Pages. Now, if you ask a 25-year-old, do you know what a Yellow Pages is? What? So
yeah,
marketing has changed. And the most important thing has not really changed in marketing is how you treat your patients and how you get internal marketing. That has always stayed the same, and that's always going to stay the same. If you don't take care of your patients, if you don't give them a good service, they're not going to come back. They're not going to refer people. So that's the most important aspect of our philosophy in the practice is really treat the patients as the way you want to be treated somewhere else. So that's our biggest philosophy. But of course, right now with the digital marketing, we're definitely changing our aspect of external marketing, going different routes, looking to the Facebook, Google's, Instagram, Twitter's, and putting different aspect of marketing in there too.
Yeah. Do you feel like the online reviews influence your practice? Google and Yelp, is that driving a lot of activity in your practice at this point?
Absolutely. I mean, for ourselves as well, when we go to a restaurant, what do? The first thing we do, we go to Yelp to see what kind of review they got. If it's a new restaurant, you don't feel comfortable going in until you see the reviews. And to me, bad reviews and good reviews are important. I do not want to be a 5-star review and say, oh, it's the best dentist, is the best dentist. I like when I get a review, I want to have one full page of review from one person explaining how the treatment went. And when I get a bad review, I respond to the bad review immediately. I follow up. I see where did we go wrong to get that patient so upset that they had to go put that review. And I want to make it up to them. And I want to make sure that they're going to come back and get a better service than the last time they did. And every practice has a difficult patient. And I think one thing is we want to try to attract those difficult patients. We don't want to scare them off, because those are difficult patients. Once they come into your practice, it's not they're only going to bring themselves, they're going to bring multiple other friends and family, because those are the ones that once they love you, they send more patients into your practice.
Yeah, that's interesting. You've transformed their viewpoint. You've reversed their belief. The reason they're difficult is they're scared. They don't understand it. They've had bad experiences. All of this, they don't like spending the money. Whatever the heck, it all rolls into that. If you transform their belief about dentistry, and they are going to be loyal, because they're going to say, I believe this, but not now. This, Dr. Rodef's practice, his people are amazing. It changes everything. It's true. It's like, if you're not driving by word of mouth, as your primary source of new patients, that's the indicator that your experience is off, right? That what people are experiencing is not good. That's what you got to fix. It's not like, oh, geez, I need to spend more on Google. It's like, no, you need to spend less until you fix the experience, is what I found.
Absolutely, absolutely. The interesting part is that I have patients that they've been with me since 1992. She's right now, she's about 43 years old, does not want to go to any other dentist. And whatever I tell her, it's like, get it done yourself, Dr. Rodev. She needs a third molar extraction. And I've been dealing with this for the last 10, 15 years. And she does not trust anybody else. Even though I'm telling her, I know great dentists as good as I am, he's going to take care of you. She still does not feel comfortable to go somewhere else. But
she
that's
has to. Yeah, she has to squeeze into one of the little chairs, and then get treated like an 8-year-old. But she feels safer. Well, but dentists really need to realize that there's such an uncertainty and such an apprehension that goes into finding a dentist and getting comfortable with them, that if you do it right, they don't want to change. There's a whole segment of the population that they will be loyal right to the end. They will mourn the day you finally aren't coming to work anymore. So you're still treating patients. You're still working chairside.
Yes, I'm working 1 to 2 days a week right now, and I enjoy practicing dentistry because that's really my passion. And one thing I always tell my kids and everyone else that wants to get into dentistry is, if you're working, you gotta love your job. If you're passionate about what you do, you're not working. You're enjoying your every day. And that's what's been like that for me for the last 30 years. I mean, there's been challenging days, of course, but most of the days I'm looking forward to come to office and seeing patients.
No, it's a great profession. It's a great thing to be able to do every day. And obviously I meet dentists like you all the time they're just passionate about being able to treat people. You could easily stop working right now. You get 14 practices that are going. You're very successful, but that the core of your activity still is about, you want to be treating people. So I think that's what's driving your success as much as anything is you're not in it for the money. You're in it. You like the success and you like the challenge, but you really like helping these kids.
Absolutely. I mean, for me, it's so satisfying when there is a difficult patient that no one else was able to see, and they kind of throw it at me and say, Dr. Rodev will take care of this patient. If anybody can do it, it will be Dr. Rodev. And when that patient comes in and I'm able to get the work done with very comfortable situation, parents are happy and the kid is happy at the end, gives me a high five, that's the best reward that I can get. Even if they don't pay me anything, I'm still happy about what I've done,
That's great. Yeah. And obviously the parents are changed by seeing that, because there's nothing more uncomfortable than being a parent and you're helpless somehow. You can't make the kid not afraid, by saying, don't be afraid. It's like, that doesn't work. So
no, absolutely.
I admire your ambition as well as your passion. So when you first get into dentistry, was there something about it that unexpected, like wow, I didn't really realize this about the profession? Was there anything like that?
I mean, the challenging part for me was really at the beginning when I started practicing dentistry was I had to deal with a difficult child or scared child. And then at the same time, I realized the only reason that kids are really scared is because of their parents. that was the challenging part for me, to be able to coordinate and associate both parts together and be able to get both of them comfortable. A lot of times I was able to comfort the kids, but I was not able to comfort the adults, the parents. They were still scared because of their bad experience as a childhood. They couldn't let go, and that fear gone to the kids, and the kids feel the same way. And I was able to calm down the kids, showing them that, look, there is nothing to worry about because nothing's really hurting, and might be a little bit of pinches when I'm doing the Novocaine and giving the shots. But after I'm done with the shots, I make sure that you're 100% numb and you're not feeling anything while I'm working. And a lot of times I learned that if the kid was crying, I always stopped and gave more Novocaine to make sure that the kid is not feeling anything during the procedure. But the fear of the parents would not go away because that's something that's been there for 20, 30 years. And that was a challenging part for me at the beginning. But now I've learned to explain that to the parents and show them and tell them what's the reason they feel that way. And the interesting part is the parents come in and say, you're right, I'm scared. I really, and I can see my kids feeling that way is because of me. So a lot of times I end up like a mom comes in with a kid and the mom is extremely nervous. I tell mom, if you want to send the grandma or you want to send the dad or someone else that is not scared, it's going to make it more pleasant and pleasurable time for your kids. And that's what they do. They bring their someone else to stay with the kids. One of our signature things about our practice is we allow parents inside the room. And we want parents to work with us while we're working on a patient. I don't want them to be outside waiting to see what's going to happen. I want them to be interactive with their kids. And when the kid feels that the parents are in the room holding their hands and letting them know that they're there for them, a lot of the fear goes away and they become more comfortable during their treatment.
Now that's interesting because I think a lot of pediatric dentists, their goal is to keep the parent out of the room. Just because the parent a lot of times transfers more stress rather than assistance. But it sounds like you've worked out a way to make it work for both the parent and the child.
No, absolutely. And also as a parents myself, I would not want my 2 or 3 year old kids to go to a pediatrician and go by themselves inside the room. I want to be there and I want to support them. And if there is a procedures, I want to be able to hold their hands to get the procedures done. One time my son had to get 3 stitches when he was 4 years old. And it was a very traumatizing to me and to the pediatrician. But I was there. I hold his hands, let him get those stitches and not, support him and say, okay, it's going to hurt a little bit. It's going to hurt. I'm here for you. Don't worry. We go through it. And it was very comfortable going through it,
Yeah, that's you've really refined, and I imagine dentists learn this from you. You've created a philosophy, but also a way of interacting that your dentist can emulate, and it's obviously created success through multiple practices without you having to be in every practice. Because I imagine there's some you don't have to go to at all. You've really established a culture that has worked and that people can learn. Now you have a lot of people working for you at this point too, and like you're gonna have you're moving a lot of patients through. So what level of team size do you have? Like, do you have any idea?
Yeah, we're somewhere about 450 to 500 employees right now in the practice. I do have a really good upper management team, and I think in a term of my success, I really have to appreciate and say thank you to my regional manager, my chief operating officers, and my HR manager, and all the managers that been working with me. And the interesting part is most of the practices were really, most of my managers been with me for more than 10, 12 years. And some of them, they started from a dental assistant. Some of them, they started as a front desk girl, you know, and they've grown into the practice. And now they're a manager, they're a regional manager, and helping me to grow my practice. And that's one of the, I think, the culture in in my practice is to grow the employees same way I've grown. I want them to accomplish some more than they think they can reach.
Well, that's really the definition of leadership, is you see more in your people than they see in themselves, and you help them achieve that. And I think that's what you're doing with associates, but it sounds like you're doing it with your team. The only way you could be in practicing dentist a couple of days a week is having a strong executive team. And I know some of them, and there's some great people, but that's a team that has to expand all the time too. It must be quite an HR challenge with that many people, but because there's so many positions to fill, and then there's people taking time off and moving and all of that stuff. But you get enough staff where half the time their kids are filling your practice. It seems like with that many patients, with that many team members.
We do, actually. We have a lot of staff that they brought their kids, and their kids are grown, and they've joined our group as well and work for different offices. So yeah, it is exciting about that part.
Yeah, so you've built a multi-generational legacy at this point. Well, that's terrific. Well, what would you say? I'm going to wrap this up now. When if somebody is coming out of dental school, what would you recommend that they do? What would be the first couple of things you'd tell them to do?
I mean, my son, as you know, my son is graduating from dental school in a couple of years. And one thing I've been trying to tell him in the dental school is that you definitely need to see what your passion is and what you're going to enjoy. And if you're enjoying a department, for example, you like periodontics, definitely go for a specialty. If you like ortho, definitely go for a specialty and become a specialist. At the same time, I really expect all the dentists really take some management courses, be able to learn some business before they start their practice. That teaches them a lot as they grow their practice, and see what their passion is. There are some dentists that they come in and open one or two office, and they stay there, and they don't want to deal with more practices. And there are other dentists that they are interested to grow their practice and open multiple offices. To me, is having a clear vision of where you want to go and grow your practice that way, to be less mistakes, and be able to grow much faster that way. Overall, I think as a new graduate, I would definitely want to work for someone at least for 2 or 3 years before I open my own practice, because it gives me exactly where I want to be and what would be my passion in dentistry and what I want to do. And you learn a lot when you're working for different offices. You learn what you like. For example, one of the things with me was I worked at the beginning. I worked in about 10 or 12 different locations as a pediatric dentist. And one thing I learned was that I cannot handle the upper class patients in my practice. for me was a little bit challenging with parents' the expectation rather than middle class family. Their expectation of me was less toward, and they kind of appreciate what I did rather than me appreciating higher class patients in the practice. If does it make sense to you or?
No, I understand. Yeah, I think that's, and I don't think a lot of people give that advice either. It's like, think about who are the patients that you want to be treating. I mean, it's like, what will be satisfying for you if you want to go into the inner city and open a practice where you're helping those people. You know, it may be harder to make as much money as a Beverly Hills practice, but it may be more satisfying every day. You may enjoy a 40-year career that's incredibly fulfilling. So you have to find that out for yourself. So I think that's really good advice. Well, Dr. Rota, thank you very much for taking your time and telling us your story. I think there's a lot people could glean from this, and as they chart their own course through dentistry and figure out what they want to do and what challenges are coming to them, but also just an appreciation that you just have such a wonderful appreciation for the profession. It's a pleasure to know you and see how far you've gone and how far you're going to go. And I know members of your team that are great people too, like Evelyn and everybody there. They create great support for you and they represent you well. So thank you for your time.
Thank you so much, Fred, for inviting me to this podcast. I'm really excited. And I truly, if anyone is interested to know a little bit about me or have any questions, if I can help you guys grow your practice, please let me know. Our company name is Children's Dental Fun Zone. You can Google us, and if you're looking, our phone number, my phone number, personal phone number, if you don't mind, I can even put it up for you guys to reach me. I'll be more than happy to help you out in any way. My cell phone number is 310-625-3773. You can call me anytime. I'll be more than happy to help you guys out if any questions you have.
Well, thank you. That's very generous of you. And I'll put the number in the show notes as well. And, and if ever I feel lonely at like 12 or 1 o'clock in the morning, I'm probably going to call you.
Definitely. No problem, Fred. I'll be more than happy to talk to you. I enjoy talking with you anytime. You can call me anytime.
Terrific. All right. Well, everyone, I hope you got tremendous value out of this. It's always a pleasure to talk to a successful dentist who's risen to the challenge of this profession. And as always, if you like this podcast, share it, subscribe, and pass it around. And until then, keep on being remarkable.
Thank you.